Yeah, let's start.
Good afternoon, everyone. I would like to call this October Jail Oversight Board meeting to order. Would everyone please rise for the Pledge of Allegiance?
Flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. First order of business is public comment. And as always, please limit your comments to 5 minutes or less. And at the outset, they have to be with regard to items that are on the agenda. There will be another opportunity for public comment at the tail end of the meeting that can be about anything county jail related. So if there are any comments, please come to the podium and please keep your mask on while speaking. All right. Next item is an approval of the September meeting minutes, but I think we also would need to approve the special meeting minutes. So we'll take these in order. Is there a motion to approve the September regular meeting minutes?
I make a motion to approve the regular September meeting minutes.
I'll second.
A motion and a second. Were there any questions, comments, edits on the September minutes? Hearing none, all in favor? Aye. Any opposed? The ayes have it. And now, is there a motion to approve the minutes for the special meeting that occurred, what was the date? September 28th.
I'll make a motion to approve the minutes from the special meeting held September 28th.
Second.
Motion is second. Questions, comments? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. Okay, next item would be the approval of the staffing penalties for September. And Ms. Mellon is not here. Kelly, I think you're ably filling in?
I am.
Okay.
Good afternoon, members of the board. In the month of September, GEO accumulated $263,842.33 in staffing penalties. That was a $22,000 increase from last month, which is a record high. There were increases in medical and security vacancies. Staffing rate is at 81%. Effective staffing rate is at 73%. GEO continues to offer a recruiting bonus for new hires. And in the month of September, 93 interviews were scheduled, with 67 no-shows and 8 did not pass the NCIC clearance. 4 officers completed training in September, and currently we have 8 officers that are in training right now. Though in September there were some hires, 2 booking specialists, an RN for second shift, a facilities systems coordinator, a case manager, central records clerk, and a prep counselor.
Questions or comments for Ms. Shaw?
What is the, what's the process when the individuals apply? It just seems like, and it's a very high number of people who don't show for the interview. So I was just wondering, is it online that they're applying, or?
The majority of it is online.
Okay.
And I do think that part of probation, sometimes individuals have to apply for a job. So it appears that maybe sometimes individuals aren't serious about the job. They're just doing part of their probation plan.
Okay.
I'll just note that, which Ms. Shaw said, that this is definitely a record staffing penalty.
Correct. 22,000 up from last month.
Yeah, and that last one was a record. So
A new record.
we keep breaking records every month for staffing penalties.
Yeah, you know, I know that it's a challenging hiring environment everywhere, and particularly within the jail and incarceration space. But, you know, I think we're going to continue to do what we can to work with GEO to try to keep this at a manageable level during this interim period. Thank you, Kelly. Is there a motion to approve the staffing penalty? Thank you, Ms. Love. Is there a second?
Second.
Thank you, Controller Phillips. Motion is second. Any questions, comments before we vote? Hearing none, all in favor?
Aye.
Aye. Any opposed? The ayes have it. Looks like someone's being, okay. We're good? Thanks, Sean. Next item is a coronavirus update. Ms. Shaw.
In September, 113 inmates were tested with 4 new positive infections. Currently, we have 3 residents quarantined in upper medical with positive infections. In September, 9 staff members were tested with 6 new positive infections. 1 staff member is still out on quarantine. Of the 404 new commitments for the month, 102 were previously vaccinated. Our current vaccination rate is steady at 38%, which was the same as last month.
Questions from the board? Ms. Shaw, just for the public's reminder, can you tell us what we're doing in terms of supporting vaccination going forward?
Anyone who is symptomatic, medical will test them. And if when transfers are leaving the facility, they're tested within 2 days of them departing.
In terms of vaccination, are we still making the vaccine available to those who would like it?
It is still available, but unfortunately, we did have 0 vaccinated in September.
Wow. Okay, well, I think we should redouble our efforts there because, it is a transient population. And I'd like to think that of the however many came in, and you would probably have that number, how many entered in September?
Out of the 494 new commitments, 102 were previously vaccinated.
Okay, so I guess by that logic then, we've got like 390 or so people who came in unvaccinated and we weren't able to vaccinate any of them.
Correct.
Okay, well, let's see what we can do there, and if perhaps there are some creative ideas, talking with Gio about, incentives to vaccinate, again, sort of doing what we did previously, which was bringing in folks from intercommunity health to help answer any questions that people may have. We got to do better than 0.
Understood. We'll strengthen the effort to get those vaccinated.
I have a question. Do you know if any of the denials of vaccinations offered were because it was the wrong vaccine? Maybe they had received number 1 on the outside?
I would have to look into that, Ms. Love. I don't have that with me.
That may be one of the reasons, particularly if I just think it should be data that's collected, because I know in the past, when Crozier was running its vaccine clinic for the public, folks from medical called us if they had received number 1 of Pfizer. They came back while incarcerated. So I was just curious, knowing that we don't have our clinic anymore, but there are others around, that we make sure we offer to them if they're in the phases of 1 and 2. That's my only comment.
Understood. I'll get back to you with that. Thank you.
And I acknowledge that this far into the vaccination rollout, most people who aren't vaccinated who are coming into the jail have probably had ample opportunities to get vaccinated. So it's not, I would assume that your ability to vaccinate now is going to be different than it was 5 months ago. Mm-hmm. But again, nevertheless, I think there's got to be better opportunities.
Understood.
All right, anything else on coronavirus?
I have a question. Were any of the residents sick enough to be hospitalized, or were they all managed in-house?
We do have 1 out in the hospital with COVID, due to
Okay.
COVID symptoms.
Who was or was not vaccinated?
I'm not sure. I'll
Okay.
get back to you with that.
You don't have to go back to me. That was more of a curiosity than any
Yeah,
information.
we do have 1 out in the
I was just
hospital.
curious how ill those who were infected were. Thank you.
Okay, anything further?
No, thank you.
All right, contraband update.
During the month of September, the facility conducted 8,710 cell searches, 158 canine searches, 6 shakedowns, 21 incidents of serious contraband were found. On Monday, October 11th, K-9 conducted a random exterior car search of 30 vehicles with 0 incidents of contraband found.
Questions for Ms. Shaw?
What does, is that number, is that pretty much correspond with, I know last month there wasn't a car search, but the other numbers, like as far as the contraband searches and the shakedowns and whatnot, is that pretty much correspond to the same number the month before?
It does, except this month, in September, there were more serious contraband was found,
Okay,
almost double than what was found last month.
okay.
And the cell searches, canine searches, and shakedowns were pretty much identical to the ones performed in August.
Okay.
Any other questions or comments?
I'm just glad that they were able to get the vehicle searches in, because with 0 done last month, that this is, it's good to do that, because I assume it's a deterrent for people wanting to bring them in. So that was good to hear.
Thank you.
All right. Thank you, Michelle.
Thank you.
Next item is a deprivatization update, and I will look to Mr. Majid El-Sayeh to give us the update as always.
Good afternoon, good afternoon, members of the board, members of the public. Right after the vote last week by County Council, the next day we started working quickly on putting together the transition plan and prepping for a meeting with the GEO group, which is being coordinated by our legal counsel, and we expect to be meeting within the next week and a half. We've been spending quite a bit of time on defining the scope of the HR contract for support of the hiring, and it's growing a little bit in that the county does not have an automated application tracking system, which would make it really arduous to try to hire the large number of people that need to be hired at the prison. So we're assisting the county with looking at automatic tracking systems. So the scope of the HR contract will actually grow to include support and assistance for the overall county HR department. That'll help it do better in the future with work over and above the prison work. And the county's been already interviewing candidates for various senior positions at the prison. So those are the main areas of activity at this time. I welcome any questions.
Questions from the board?
Just had a question as to whether the letter or notice was given to GEO to terminate. Was it given, or?
It was on Thursday. It was
approved subject to solicitor's approval?
hand delivered on Thursday.
Okay.
I guess what will the process be for, so as these higher level or personnel is being interviewed or the applications, what's the process of where it comes in front of the JOB? At what point? Like what number is it? What's it dwindled down to? Like different things like that?
I'm sure the warden will be brought to the count, but I don't know about others other than the warden. That
Well, with the warden though, does 10 applicants brought to the JOB, or is it brought down to?
Brian, I can speak to that a little bit.
Okay.
Sure. So as you may know, we utilized a national search firm to assist us, given the fact that, again, challenging times to hire, particularly challenging with regard to incarceration, and they have done a pretty thorough job of soliciting interest for the warden's job, and they have brought to the county a small number of kind of finalists for consideration. Okay. We're in the process of doing just a sort of a preliminary meeting with each of those finalists, but there will absolutely be a group of finalists that are brought to the Jail Oversight Board, to County Council, and really, other relevant members of the various agencies that are relevant here, because we want to get all interest in terms of this hiring.
Okay, thank you.
So, yeah, more to come on that front, but in the very near term.
And I will add that GEO reached out to us and expressed their intention to work closely and cooperatively through this transition.
Any other questions from the board? Comments?
Do we know the date that's 180 days? I mean, I know I'm assuming someone does, but maybe
The date,
the date where it is 180 days out.
it's in latter part of April, I believe.
Okay.
April 7th? Okay, April 7th, sorry.
April 7th is the date. And just again, worth noting that per the contract, GEO is responsible to support the transition an additional 2 months after that date. All right, any other questions? Thank you, sir. Ms. Shaw, the warden's report.
Current population, 1,555, which includes 1,317 county males, 184 county females, 14 transfers, 36 lodgers, 4 male weekenders. For the month, we had 494 commitments, 508 total discharges. The recidivism rates, the recidivism rate stays at 65%. Major incidents, sadly, we had an inmate death on Wednesday, September 15th. A male resident was found unresponsive in his cell at 9:19 a.m. The Jail Oversight Board, CID, and medical examiner were notified immediately. GTL update, video visitation is from 9 a.m. to 11:30 a.m. In-person visits begin at 12:30 p.m. each day. Video visits remain free of charge. Video visits and in-person visits are scheduled online 2 days in advance. 469 video visits were scheduled in September, and to date, 5,557 video visits have been scheduled. There were 406 in-person visits scheduled in September. Behavioral health update. 8 residents are on the Norristown State Hospital wait list. 3 residents are possible diversions to other programs. 83 residents were discharged to inpatient treatment facilities in September. Education programs. Contact teaching continues in small, same unit cohorts. For the month of September, 25 GED tests were administered with a 51% passing rate. 2 GEDs were earned, bringing the year total to 23. There were 75 students enrolled in GED preparation class. There were 7 students enrolled in the Flagger training program. There were 15 students participating in computer literacy class with 2 completions. Treatment programs. For the month of September, 78 residents participated in Prep 1 with 19 completions. 26 residents participated in Prep 2 with 4 completions. The MAT Vivitrol program had 27 residents participate in the program with 2 graduates. Currently, we have 27 participants, and 11 of the participants are female. Maintenance update, 1 of the 2 new dishwashers have been installed. We look forward to getting the next one installed. That will cut down big time on our styrofoam trash. And members of the board, I would like to note that on September 27th, the Pennsylvania Department of Corrections audited and approved the facilities training curriculum. The approval will remain in effect until June 18th, 2024. Congratulations to the facility and our training administrator, Captain John McCarthy. Also, I'd like to note that on October 1st, the courts reopened the weekender program, And last Friday, we opened up the DUI program to house 25 weekenders. And that, as you know, the DUI building is a dormitory setting, sectioned off that sleeps 4, and we're only putting 1 person in each section to have COVID precaution. And lastly, I would like to make an announcement to the public that on Friday, October 22nd, and Saturday, October 23rd, from 9 a.m. to 4 p.m., Delaware County, Chester Partnership for Safe Neighborhoods, and the District Attorney's Office are hosting a Wipe Out Your Warrant event in the Christian Church of Chester. All persons with nonviolent charges and an outstanding CP or MDJ bench warrant, including summaries, will have an opportunity to surrender themselves to authorities in a safe, non-governmental setting. Thank you to Lieutenant Root, our records manager, for representing the jail and assisting on both days. This information is posted in our case manager's offices for the population to see.
All right. Any questions for Ms. Shaw? Any comments?
Thank you.
Kelly, just sorry, one. Do you have any update on the buprenorphine program?
Yes, we continue to meet every 2 weeks, and the Crozier staff is ready to go, and unfortunately, GEO does not have the medical staff to do the program, but we continue to meet and just stay in touch with each other and give updates to the community service center that wrote the grant for us.
Do you know what efforts GEO is making to hire those people?
They hired a third-party company to help recruit, but unfortunately, they haven't had any luck.
Okay,
Thank you.
thank you. All right. Public comment. Anyone from the public like to speak at this point? Hearing none. Any last comments, thoughts from the board?
I'm thinking that as we go into the next couple meetings, that maybe, I don't know, maybe, some of us, I'd like to know more what the role of the board should be in the transition. We had the subcommittees. Do we need to make sure the subcommittees are connected to the people that will be working on that part of the transition? So I know it's just been unrolled and, approved, and I know the transition people are working, but I think it would be helpful for people on the board to know where they can really fit in specifically, as opposed to, and maybe it is just meeting, hearing what's going on each month. But if there's more that we want to do or, think we have to offer, especially on the reentry and the work Mr. Corson was doing on the medical assistance and all that, we should probably hone in on that a little bit.
Yeah, certainly. I think, any member of the board who would like to, get more involved with any aspect of the transition is certainly welcome to volunteer for that, whether at meetings or between meetings.
Yeah.
All right. Anything else from the board? Hearing none, I'll entertain a motion to adjourn.
Oh, there was no public comment, right? So, sorry.
Judge Brennan, motion? Okay.
Second.
Thank you, Mr. Corson. All in favor?
Aye. Aye.
Any opposed? We are adjourned. Thank you all.
Definitely. That should be in a minute.